Hi there, this is Nursing Education Videos. Today I will be going over the Hyponatremia and Hypernatremia quiz for NCLEX exam on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for this information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. So the hyponatremia and hypernatremia quiz for NCLEX exam. This quiz will test your ability to differentiate the causes, signs, and symptoms and nursing intervention between these two conditions. The NCLEX exam and your nursing lecture exams will ask you questions about how to provide care to patients with low or high sodium levels. The questions on this quiz are some of the most common exam questions students are asked about hyponatremia and hypernatremia. Other fluid and electro quizzes are also on the website. So the first question is, a patient has a sodium level of 123 and presents with confusion. The doctor diagnoses the patient with syndrome of inappropriate antidiuretic hormone secretion, SIADH. Which type of hyponatremia is this? A. Hypovolemic, B. Euvolemic, C. Hypervolemic, or D. Antivolemic. If we look at the review notes, euvolemic hyponatremia is where the water in the body increases, but the sodium stays the same. The causes include syndrome of inappropriate antidiuretic hormone secretion, which is due to the increased amount of secretion of antidiuretic hormone. This hormone retains water in the body, which dilutes sodium. So a diuretic like Lasix, which is called furosemide, it causes someone to urinate frequently. So increased urination is what a diuretic causes. So an antidiuretic is a medication that helps the body retain water, which dilutes sodium. So from this review notes, the answer should be B, euvolemic. So euvolemic, it would be euvolemic hyponatremia. So the sodium normal levels are 135 to 145. This patient has a sodium level of 123. Question number 2. A patient with a sodium level of 112 is taking lithium. Which of the following is a nursing priority? A. Hold further doses of lithium. B. Monitor lithium drug levels due to risk of toxicity. C. Monitor potassium level due to increased risk of toxicity. Or D. No priority is needed. 112 is a normal sodium level. So 112 is a hyponatremia. Again, normal levels are 135 to 145. If we go to the notes for hyponatremia, let's see if there talks anything about lithium. So on the review notes under hyponatremia, if patient takes lithium, remember to monitor drug levels because lithium excretion will be diminished, and this can cause lithium toxicity. So from what I'm understanding from this information is that if a patient has reduced sodium levels, then their lithium excretion will be diminished, and that can cause lithium toxicity. I'm just going to look up lithium and sodium interaction mechanisms. So I don't know how credible this website is, but on psychdb.com, a quick blurb it says here, when there's sodium depletion, example hyponatremia or low sodium intake, lithium undergoes higher reabsorption, resulting in higher serum levels. Conversely, when there is high sodium intake, there is decreased lithium reabsorption, resulting in lower serum levels. So is from that information, going back to question number 2, a patient with a sodium level of 112 is taking lithium. Which of the following is a nursing priority? It would be B, to monitor lithium drug levels due to the risk of toxicity because of higher lithium reabsorption due to low sodium levels. Just going to pause this for a moment. All right, next question, number 3. A patient with a sodium level of 178 is ordered to be started on 0.45% saline. What is the most important nursing intervention for this patient? A. Maintain patent IV. B. Give rapidly to ensure fluid levels are shifted properly. C. Clarify doctor's order because 0.45% saline is contraindicated in hypernatremia. D. Give slowly and watch for signs and symptoms of cerebral edema. So sodium level of 178 is hypernatremia. Just going to bring up the hypernatremia notes. Just going to pause this for one moment. So this is the hypernatremia notes. Nursing interventions for hypernatremia. The doctor may order to give isotonic or hypotonic solutions such as 0.45% normal saline, which is hypotonic and most commonly used. Give hypotonic fluids slowly because brain tissue is at risk due to the shifting of fluids back into the cell. Remember, the cell is dehydrated due to hypernatremia, so too much sodium, and the patient is at risk for cerebral edema. In other words, the cell can lyse if fluids are administered too quickly. So back to the questions here. Maintaining a patent. So the number 3, the priority is what is the most important nursing intervention for this patient? It would be D. Give slowly and watch for signs and symptoms of cerebral edema. Next question, number 4. You have completed diet teaching with a patient who has hypernatremia. Which statement by the patient causes concern? A. I will buy fresh vegetables and fruits. B. I will avoid eating canned foods. C. I'm glad I can still eat sandwiches with bologna. D. I will avoid cooking with butter. So hypernatremia is too much salt. And we would want to reduce our salt intake. So the nursing interventions here is to know which foods have high level of salt in it, such as bacon, butter, canned food, cheese, hot dogs, lunch meat, processed food, and table salt. So the diet teaching with patient who has hypernatremia is to ask them to reduce their salt intake. So buying fresh vegetables and fruits, avoiding eating canned foods, and avoiding cooking with butter would reduce your salt intake. The statement C, I'm glad I can still eat sandwiches with bologna, is the answer that causes concerns, because you would want to reduce your lunch meat intake. So the correct answer for this question is C. I'm glad I can still eat sandwiches with bologna. So you would want to educate and teach, you would want to teach the patient to not eat lunch meat due to the high salt content. Question number 5. A patient with Cushing's syndrome or Cushing's syndrome has been experiencing an infection and has a fever of 102 Fahrenheit. On assessment, so 102 Fahrenheit. On assessment, you find the patient to be confused, restless, has dry mucous membranes, and flushed skin. Which finding below correlates with the presentation of this patient? So first, we will look into what Cushing's syndrome is. Just going to put this on pause. Alright, on the National Institute of Diabetes and Digestive and Kidney Diseases, a part of the U.S. Department of Health and Human Services, Cushing's syndrome is a disorder that occurs when your body makes too much of the hormone cortisol over a long period of time. Cortisol is sometimes called the stress hormone because it helps your body respond to stress. Cortisol also helps maintain blood pressure, regulate blood glucose, also called blood sugar, and reduce inflammation, and turn the food you eat into energy. So what happens in Cushing's syndrome is that because there is too much of this cortisol that is produced, so because your body makes too much of this hormone cortisol over a long period of time, it causes increased sodium absorption. So the statement is increased renal sodium reabsorption, which contributes to hypertension in Cushing's syndrome. Increased renal sodium reabsorption would be hypernatremia. This information here is from the Journal of Clinical Endocrinology and Metabolism, Volume 103, Issue 7, July 2018, pages 2583 to 2591. So if we go back to the question here, a patient with a Cushing's syndrome has been experiencing an infection and has a fever of 102 Fahrenheit. So Cushing's syndrome is increased cortisol levels. Increased cortisol levels would be increasing reabsorption of sodium. So we would assume that the patient would have high sodium levels, would be hypernatremic. So normal sodium level is 135 to 145. On assessment, you find the patient to be confused, restless, and has dry mucous membranes. So having high sodium levels can cause a patient to be quite dry. So which finding below correlates with the presentation of this patient? A, sodium level 144, B, sodium level of 115, C, sodium level of 170, or D, sodium level of 135. So it would be C, sodium level of 170 is hypernatremic. So the next question, number 6, which patient below is considered hypernatremic? A patient with a sodium level of 155, a patient with a sodium level of 145, or C, a patient with a sodium level of 120, or D, a patient with a sodium level of 136. just making sure that we read it correctly. It's hypernatremic, and it would be answer A, a sodium level of 155. Next question, number 7. A patient with a sodium level of 115 is ordered to start declomycin. Which statement is not true about this medication? Declomycin is an antidiuretic hormone antagonist that treats SIADH. Declomycin is part of the tetracycline family. Declomycin is to be taken with food, preferably milk. Or D, declomycin is contraindicated in children and pregnant/nursing women. So, sodium level 115 is hyponatremic. We will go to the hyponatremic notes and see if it talks about declomycin. It does. So again, it says here, syndrome of inappropriate antidiuretic hormone secretion is SIADH, which means it has too much secretion of the antidiuretic hormone. So too much secretion of the antidiuretic hormone causes one to urinate too much, which causes hyponatremia. So SIDH means too much antidiuretic hormone secretion. So sometimes it's a little confusing when you think in a SIADH. The nursing interventions for hyponatremia caused by SIADH with syndrome of inappropriate antidiuretic hormone secretion, which would be fluid restriction, were treated with an antidiuretic hormone antagonist called declomycin, which is part of the tetracycline family. And the information here is to don't give with food, especially dairy or antacids, because it binds to cations and this affects absorption. So for question number 7, which statement is not true about this medication? It would be C. Declomycin is to be taken with food, preferably milk. That is not true. So you would select C. Number 8, patient with hypovolemic hyponatremia is started on IV fluids. So hypovolemic means low fluid status plus hyponatremia means low sodium status. Which of the following fluids do you expect the patient to be started on? A, 0.45% saline, B, 3% saline, C, D5W, or D, 0.33% saline. So for hyponatremia, it's going to go to the hyponatremia notes. So the nursing intervention would be to give IV sodium chloride infusion to restore sodium in fluids. 3% saline hypertonic solution is harsh on the veins, given in ICU usually through a central line very slowly, and must watch for fluid overload. So in this case of a patient with hypovolemic hyponatremia, it would be answer B, 3% saline would be what the patient would be started on. A patient has a sodium level of 119, which is hyponatremic. Which of the following is not related to this finding? Over-secretion of antidiuretic hormone, low-salt diet, so A, over-secretion of antidiuretic hormone, B, low-salt diet, C, inadequate water intake, or D, hypotonic fluid infusion. So we'll go over these answers. Oversecretion of an antidiuretic hormone would cause someone to not urinate. Not urinate means they're retaining fluid. Retaining fluid, which means they would have low sodium levels. B, a low salt diet would also cause them to have low sodium levels. C, inadequate water intake would cause someone to have high sodium levels. Because high sodium levels means low volume of water. Low sodium levels equals to high volume of water. Or D, hypotonic fluid infusion, which is an overload. So based on this information here, which of the following is not related to this finding? On exams, I like to cross off the ones that are not correct, so you could reduce the choices. So A would probably be not correct, because that would be low sodium level. Low salt intake would also probably be not correct as well. And it would leave you with C or D, inadequate water intake or hypotonic fluid infusion. So having too much fluid, so a hypotonic fluid infusion overload would indicate a low sodium level as well. Because if you have high sodium, you'd be thirsty. High is dry, you can say. You're thirsty, you want more fluids. So inadequate water intake would probably lead someone. Let's see here. So if we go over the causes of hyponatremia on registerednursrn.com, remember mnemonic no Na+. So overload of fluid with congestive heart failure, hypotonic fluids infusions, and renal failures is a cause of hyponatremia. Low sodium intake is also a cause of hyponatremia. Antidiuretic hormone oversecretion, so SIADH, syndrome of inappropriate antidiuretic hormone secretion, also causes hyponatremia. So those are the three things that I had crossed off. And so the answer would be C, inadequate water intake is not related to this finding. Because if you drink a lot of water, your sodium level would decrease because it's diluted with the fluids. I think that is the understanding. Then question 10. Which patient below is at risk for experiencing hypovolemic hyponatremia? Patient with congestive heart failure. B, patient with cirrhosis of the liver. C, patient on IV saline at 250 cc's per hour. D, patient with nasogastric tube suction experiencing diarrhea. So hypovolemic hypernatremia would be low fluids and low sodium. So what would cause someone to have low fluids and low sodium? So a patient with congestive heart failure, they're most likely retaining fluids. Patient with cirrhosis of the liver most likely be retaining fluids. patient on IV saline at 250 cc's per hour is also having quite a bit of fluids per hour. So those three would cross off what is hypovolemic. And then patient with a nasal gastric tube suctions experiencing diarrhea, they are having NG tube suction, which is reducing their fluid intake. So that's removing fluids to the NG tube, as well as they are experiencing diarrhea. So both sides, they are losing fluids, which would contribute to hypovolemia, and that could contribute to hyponatremia as well. So the answer would likely be D. And then if we review back to the notes here, so causes of hyponatremia: Na excretion increase with renal problems, Ng suction, vomiting, diuretic, sweating, diarrhea, decreased secretion of aldosterone, wasting sodium. So if I was going through the NCLEX, I would choose D. If I really didn't know, based on this information, I would choose D. And number 11, a patient with a sodium level of 130. What is this condition called? So a normal sodium level would be between 135 to 145. So 130 would be hyponatremia. If I was going through the exam, I would write this down, hyponatremia. So the answers are A, either hyponatremia, B, hypernatremia, C, normal sodium level, or D, hypercalcemia. So hyponatremia is low sodium, hypernatremia is high sodium, C is the normal sodium level, D is high calcium levels. So for question 11, it would be A. So when you hit submit, it will refresh the same page and then scroll down to see your results. After you're done taking the quiz and click submit, the page will refresh and you will need to scroll down to see what you got right and wrong. In addition, below this quiz is a layout of the quiz with an answer key. If you want to print off the quiz, just copy and paste it. Don't forget to share this quiz with your friends. Please do not repost on other websites, however. So we will find out the results. Okay, here are your results. Your grade is A. Percentage of what you got right is 100. All the information on this quiz could be found on the hypo and hypernatremia review notes. So I find that helpful to know where to find the answers and then going through the quiz multiple times to have that understanding of how the questions are asked and how to answer the questions. Sometimes we know the information, but how the question is asked can cause us confusion and make us choose the wrong answer. I know that's happened to me a lot in my studies and education. So I hope this information helped by reviewing the NCLEX review quiz with you. Thank you for listening, and please feel free to subscribe and click the like button and go to registerednursern.com for more information. I hope everyone has a good day. Thank you.